In fact, the question I was just asked a moment ago is, what role could the universities play? And it seems to me what's vitally important with something like this is to bring the different sectors together. Universities are about knowledge. Government is about governing. The third sector does very important things, and I think you represent the third sector. So, is that correct? NSPCC? Mm-hmm. Well, you are from the third sector. We need, in other words, we need knowledge, we need action, we need appropriate government, but it's not all for government. It's for other agencies too. And so NSPCC is a third sector organisation, it is another agency, and has a vital role to play. And Neil McIntosh is the development manager for NSPCC. We want to hear how the third sector can fit into this.
I'll start off by recognising that, yes, I'm here from the third sector, but really today I'm speaking on behalf of a partnership in Glasgow, which is known as Together for Childhood. And I'll talk a bit about who those partners are in a while. But I want to start by reiterating the point from the points that have been made this morning, that we recognise that services alone cannot prevent adversity and safeguard all children. There needs to be involvement from the community, and the community need to take some of that on. And that is essentially what we're doing with Together for Childhood. It starts with sharing language with communities and giving them an understanding of infant mental health and how babies' brains are built, and therefore how do we prevent trauma from happening and from damaging babies' and infants' brains. So, Together for Childhood is something that's delivered in 4 sites across the UK, so Govan and Glasgow being one of them. I had got a whole list of different inequalities that children and families in Govan face, but I think the point about why inequality is a massive issue has been made this morning, so I'm not going to go over that again, except to say that Govan faces a significant challenge. What I'll talk about today is a little bit about NSPCC and try not to fall over this step. I'll speak about Together for Childhood, the need, what our outcomes are, and how we do it, essentially. I'm so glad I've got this on paper because I can't read it up there. So for people that don't know, and there's many people that didn't know that NSPCC actually offers a service in Scotland, we've been in Scotland a full presence since 2011. It includes direct service delivery as well as policy and research functions. We operate a range of services throughout Scotland through our campaigns such as Speak Out, Stay Safe in schools, and we have a service centre in Govan that delivers therapeutic interventions for families. Our practitioners are from a range of backgrounds, including social work, psychology, psychiatry, nursing, and they all work together to deliver a cohesive set of services which have an impact on infant mental health, attachment, and parent-child relationships at their core. To just set this in a bit of policy, I'm not going to go over this because it's probably stuff that everyone in this room already knows. But essentially what this slide was about was saying that a lot of what we do in NSPCC and with Together for Childhood supports a lot of the kind of current local and national policy. So on to the most exciting area of work that I've been involved with for a number of years is Together for Childhood. This is a place-based approach, partnership project to prevent abuse and neglect. It recognises that every community is different. It is rooted in the understanding that children and young people's well-being relies entirely on the relationships around them. What we aim to do is to create this powerful partnership in Govan, and with the community at the heart of that, and it will transform how the community of Govan raises its children. I mentioned at the very beginning about the community being involved in that. Just to make that point again, it's a recognition that services can't do everything. Communities have a real role to play in that. We've been building on our community engagement work in Govan, and to date, in 6 months since I started, we've managed to engage with and speak to 1,300 people from Govan, which I think is quite a significant number of people. So why was Govan chosen? I don't know if people were able to see that very clearly, but the visual on there is a kind of diagram that shows all the different agencies that work with children and families in Govan, and there's a huge number of them. And there's been significant investment in Govan for decades since the end of the shipbuilding on the Clyde. But yet, people in Govan still face significant inequalities compared to people that live on the other side of the Clyde. That's wrong, and it would suggest that something needs to change. And to us, the system needs to change, and the system needs to change to involve communities. We are seeing significant child poverty in Govan as one of the biggest factors in stopping children from growing up in a safe environment through lots of different things. Many of them have been spoken about this morning. But it's rising in Govan, and it's rising across parts of the UK because of the devastating impact of austerity and welfare reform. We are hearing stories on a daily basis about the impact that universal credit is having, especially on lone parents and low-income families. The poor people are being cut the most. What we would like to see, I should have said this on my last slide actually, while there is significant problems within Govan, what I would also recognise is there is significant strengths. One of the reasons that we chose to do Together for Childhood in Govan is because there's a really high level of community spirit. Around about 90% of people say they're proud to come from Govan. So we thought that's something that we could harness that and do Together for Childhood. So these are our kind of high-level outcomes that we want to achieve. And there, if anyone recognises Govan, you'll see a photograph of one of the children that we work with in Govan. We want children and families to know what child abuse and neglect is. We want professionals and community members to work together in a coordinated, evidence-based way. And ultimately, we want to ensure that no child that lives in Govan comes to any harm. How we'll do that? I'll kind of talk through this diagram, and it says on the top of that, process to identify the theory of change. That's a very NSPCC thing. It basically means this is how we'll understand what we need to do. So at the moment, we have looked at the data across the partnership in Govan, building on some of the work that was already done in the kind of the children and young people's profiles. So we're trying to understand what that actually means. We're also collecting the narrative. We're hearing the story from the community about what is working that's keeping children safe and what needs to improve. We're also collecting the visuals as well. So we've asked 14 families to take part in a research project with us where they're documenting their lives through photography over a 3-month period. We've asked them to take 5 photographs a day of what their life looks like. So those 3 things will help us triangulate the evidence, understand the need, identify the theory of change, whatever you want to call it. I should also mention some of the photos that are on this presentation are from the Photo Diaries project. So the previous one there, that was part of that project as well. And this will help us to identify a number of different themes that we can tackle strategically and operationally. The Together for Childhood has governance set up around it, so I mentioned that it's a partnership. Now I'm going to list some of the partners who are involved in our Strategic Partnership Board. It's chaired by the Head of Social Work for the South of Glasgow. There is strategic representation from education, from the police, from different bits of the NHS and health, third sector and the community. We also have an operational delivery group that is a network of people who work directly with children and families in Govan that can help us operationalise some of this and get those messages out there. And crucially, we've also got a community activist advisory group, which is a group of local parents who are telling us the story about what it is actually like to bring up your children within Govan. We don't yet have a kind of children's voice, but that is something that we will look at developing. Very recently, we've managed to kind of connect the dots locally, and Together for Childhood governance has become the children and families' priority from the statutory locality plans that came out of the Community Empowerment Act. So we have clear roots into the Community Planning Partnership in Glasgow, that when we're talking about changing the system, these people have got the decision-making powers and the purse strings to actually do things differently. And I should have also said as well that we're committed to this agenda for 10 years. So we think it will take us 10 years to achieve those high-level outcomes. I mentioned community engagement and capacity building before. I'm quite unique within NSPCC in that I'm not a social worker. I come from a community learning and development background, so that's kind of where I'm coming from. So it won't surprise you that I could make the argument about why a community development approach is the one that works. But I would just really start by saying that I think it's crucial to remember nothing about us without us is for us. If we are to develop and deliver services that are responsive to the community's needs and actually work for people, we need to involve them in the development, the delivery and the evaluation. Some of the things that are in development or we've done include developing a network of parent champions. We're in a bit of debate with people about what to call this, where we will recruit a number of local parents and provide them training and support. We're hoping that they'll come from a kind of unemployed background so that this becomes an employment opportunity as well. But they will be responsible for going out and doing some of that engagement work and also some of the public messaging work that I'll come on to talk about, because it's much more credible hearing for parents to hear from local parents who know what it's like to bring up their children than from me who drives in from another local authority to the car, parks my car in the car park of Govan, drives out at the end of the day and spends my money outside Govan. People may listen to me, but if it's a local parent, I think it would be much more impactful. I've mentioned about awareness raising campaigns, and I'll talk about that, and I've also mentioned our photo diaries project as well, and that's another photo from that project. So at the same time as trying to do a whole community approach to keeping children safe, we also deliver a number of therapeutic interventions. And this was a reason I chose to work at the NSPCC, was because they invest so much money and time and resource into the academic rigour and evidence base around the programmes that we deliver, so that when I come to events like this, I can quite confidently talk about the outcomes that our interventions have for families. I'll start off by talking about one of them, which is the Glasgow Infant and Family Team, which is a model that was developed in New Orleans and we brought this to Scotland a number of years ago, and it's currently going through a 10-year randomised control trial that's about to end, and we'll be able to report the outcomes that that's had, but early indication would indicate that it's been a success. It's hosted by us, but it's a partnership between the Council, the NHS, Glasgow University, and it involves a model of social workers, psychologists, child psychiatrists, working together to support both birth families, foster carers, and the child, crucially, in wider system. It offers evidence-based recommendations about permanence. So this is a very intensive assessment process that we can then recommend whether a child actually needs to go and be adopted or can be safely returned to their birth parents. Another intervention that we are delivering as part of this is VIG, so Video Interaction Guidance. It was something that was developed in the Netherlands. It was brought here by Dundee University. It is a programme where our practitioners go out to a family who may be struggling with their child's behaviour, and they film. It's a strengths-based initiative again, and people film a parent and child interaction, and that could be them making crispy cakes together, it could be the parent trying to get the kids ready for school and out the door in the morning, and then our practitioners will then take that back and review the video, pulling out the strengths, and then go back to the parent and build up their confidence that they're whilst they're struggling, they're always doing something right as well. My colleague Joe, who's sitting over there, could you wave so people know who you are, is one of our social workers who delivers a lot of these therapeutic programs. So if anyone wants more information, ask Jo, because she's much more expert in this than me. Jo is also the lead on our Parents Under Pressure programme as well, which is another intervention. It's a 20-week home visiting project for parents who are struggling but are going through the substance misuse treatment programme. And this, again, is about building their parenting capacity. We're having very good, successful outcomes from this intervention, so much so that we're exploring the possibility of becoming a Parents Under Pressure training hub in Scotland, so other organisations could buy in the training to be able to deliver Parents Under Pressure for themselves. So again, speak to Jo if you want any more information about that. I'm not going to talk too much about this because there is an actual workshop on this afternoon on sharing the science. This work was developed by the Harvard Centre for the Developing Child and a US-based organisation called the Frameworks Institute. And it developed and tested a set of easily accessible metaphors that describe early childhood brain development. So we are currently training, we decided to bring that to Glasgow as part of Together for Childhood. So we brought together a number of practitioners and said, is sharing the science something that we could do as part of Together for Childhood in Govan? The whole room was like, can we not just do this in the whole of Glasgow? And then when you tell other people about it, people are now saying, could we not just do this in the whole of Scotland? Because people get it, it's very easy to understand, and it gives parents and professionals the tools to talk about the importance of preventing adversity in childhood. Shameless plug for our workshop this afternoon, if you've not signed up for one. Another kind of public-facing sort of campaign that's a parenting intervention that we've brought is the Circle of Security. It kind of does what it says on that diagram there. It's an intervention for parents that is designed to improve the developmental pathway of children and their parents. We've been using Circle of Security on a one-to-one basis for a number of years, but we always thought there would be legs in doing it in a group work. So we've just completed a first cohort. It's an 8-week programme, and 100% of the parents that started it completed it. I don't know any other group work programme that has a 100% retention rate. So people really got it. And I'm going to read out some nice evidence that we recorded when we went to do our follow-up visits post-group. So this one really struck me. One of the big things I got from the course is about praising my child more, building them up. They're more confident now. Delight in me and organise my feelings were big parts of the course for me. I didn't used to say, I love you. If I wanted to show this, I would buy them things. Now I am more affectionate and close, and our relationship is more meaningful. Very powerful statement there. And there was another one from a parent. There were lots of overwhelming moments for me before with my child. Now I wonder what's wrong with them, and I'll talk to them about it. Sitting down and talking to them in a normal tone makes such a difference. Before I knew that shouting wasn't working, but I didn't know what else to do. Circle of Security teaches people what to do. I mentioned this before, our public awareness campaigns that are helping us get the message out there about keeping children safe and preventing adversity. Our Look, Say, Sing, Play, it's a bit of a mouthful. It was co-designed by parents in Govan, and it's all about promoting building bonds between parent and child. We had called it Building Bonds, but the parents didn't like it, so they called it Look, Say, Sing, Play, and that's okay. We're currently delivering awareness-raising training about this to professionals and parents in Govan. I haven't put this on there, but through our partnership work with Joseph Rowntree Foundation, we delivered training that explored people's stigmas around poverty to 300 practitioners in Govan over the past 3 months. We deliver Speak Out, Stay Safe in schools, and I mentioned that before. And our pants campaign, and you'll see Pantosaurus up there. And Joe, that I mentioned earlier, has the pleasure of dressing up as Pantosaurus next week, I think it is. It's really warm. So Speak Out, our pants programme, actually, what we're doing with that is now building the capacity of other organisations to deliver our pants awareness sessions in schools. So we've got an excellent partnership with Police Scotland. So actually all the campus cops in Glasgow are now trained to deliver the pants campaign. So they're taking that forward on our behalf. It's just trying to get as many opportunities to get these messages out there as we can. So some of the successes to date, I mentioned the number of communities members that we'd worked with, really strong partnership strategically and operationally, and that was really important. It did take 18 months to get our lawyers at the NSPCC and Glasgow City Council's lawyers to get a memorandum of understanding and a commitment to working together, but we've got that there. We're continuing to build better working relationships on the ground so that the whole system is much more coordinated, and the system is all about preventing adversity in childhood and keeping children safe. I think we've got good local and national political support now. Our photo diaries project that's just finished, another photo there, some of the children at the Mary Barber statue in Govan. And bringing these new programmes like Sharing the Science and Circle of Security to Govan as well, that we know are already having an impact. I should have mentioned this earlier. I mentioned that we invest significantly in our investment. I'm not coming here today to say Together for Childhood is the answer to preventing childhood adversity. We think it could be an approach to doing that. But we have put a significant evaluation resource around this to evaluate the process that we're going through and the outcomes that we will achieve. So they have just been appointed and start in April. But I just kind of want to go back to something that was said this morning. Together for Childhood is, for me, something, that's some of the children that we work with, something for me that will help us develop a whole system approach to ensuring that all children in Govan and our other communities in England are loved, safe and respected. Thank you.